Hi, I'm Dr. Van Yee from the Center for Aesthetics and Plastic Surgery. We are going to start our What You Should Know series, and the first topic is going to be facelifts. What should you all know about facelifts? This is a very common procedure that I perform here at the center. I've been doing them for decades in reality. Since I started practice 22 years ago, most of the patients back then were in the 60s, 70s, 80s, and now a lot of patients are in their 50s, early 60s. So we've really seen a transgression to a much younger patient profile as related to facelifts. But what do you need to know about a facelift? Why does somebody come in and want to have a facelift? Well, it really boils down to a lot of aesthetic issues with the face. It's a complex structure, obviously. The facelift itself is really a procedure that deals with the lower third of the face, the jawline, and the top part of the neck. Now, we very frequently combine facelifts with eyelid surgery, brow lifts, lip augmentation, fat grafting, specific neck lifts, but the actual facelift component really addresses this part of the face, and that's really where people have a lot of concern. Things get saggy or droopy and they want a refreshed but natural appearance. One of the best ways to kind of mimic what a facelift is going to do for you is just go to the mirror. Who of us hasn't done that at least dozens, if not hundreds of times in the mirror? And that's a relatively good representation of what we can achieve with a facelift. And if you're all concerned about that, come in here, let me show you exactly what that means, where the incisions would be, and how much improvement. So what is one of the most important questions about facelifts? Again, who is a good candidate? Well, obviously health status is important. Do you have any significant medical conditions that we need to be concerned about? That issue aside, assuming from a health point of view you're a good candidate, what are we trying to address? And that is the rejuvenation of the lower part. When we age, our face loses elasticity and it loses volume. And that's why many things like fillers, fat grafting, Juvederm, Restylane have become so popular, as we're trying to restore volume. But that's only part of the restoration process. The repositioning of tissues is another part of that process, and that's elevating tissues. It's pulling things back up into the cheek to correct jowl, folds, laxity of skin, the platysma muscle in the neck. That is a critical part of the facelift, but it has to be done naturally, otherwise people look really artificial. It has to be done in combination sometimes with other aspects of the face in order to have everything look balanced and natural. So that's really what we're trying to achieve, and that's one of the most important, critical questions to start with. Who's a good candidate? Those patients that have the laxity in this area. It's not just lower the neck, it's not just the upper face or eyelids or forehead, it's that part of the anatomy where we need to start if we're going to start talking about a facelift. Any questions about, please come in and talk with us in person. We'd love to get to know you.